And June 1st means it's Pride Month. So happy Pride Month. Over the next couple of few weeks, we traditionally see major cities having their annual Pride parades, celebrations. And I say traditionally because last year, of course, most of those didn't happen. Well, this year, thanks to the COVID vaccine, the parties are back on. No, not all the parades, but the spaces and celebrations. You're going to see those return. And as Kent explains, that's a big deal, especially for LGBTQ kids who have had a really tough year.
Happy Pride!
With Pride parades and celebrations as we knew them canceled amid the pandemic a year ago, the empty streets were a source of concern for Dr. Angela Cade Gebford.
I think it's particularly hard for LGBTQ kids.
At the time, Dr. Gebford, medical director of the Gender Health Program at Children's Minnesota, had already seen signs that LGBTQ kids were struggling with the isolation brought on by the pandemic.
For LGBTQ kids, that physical distancing and social distancing when schools closed was really particularly hard. Youth tend to come out to their peers first. So they tend to be out to their peers, either about their relationships or their name and pronouns first, and then at home. So they've sort of lost that social network.
What have you seen since then?
What I have seen in the kids that I've taken care of is increased depression and anxiety, increased feelings of isolation, feeling like they are at home with parents who don't understand their identities, may not respect their identities or use of name and pronoun. So that's a lot of what I've been seeing. And nationally, that's what we've been seeing as well.
According to a new national survey conducted by the Trevor Project, a national organization providing crisis intervention and suicide prevention services to LGBTQ youth, 42% of respondents seriously considered attempting suicide in the past year, while 48% said they could not access the mental health care they desired.
What does that tell you?
Yeah, it tells me that we have a little bit of a mental health crisis in this country just for all kids, I think, in general. One thing that we've seen here at Children's Minnesota is that since the pandemic, our emergency department has been filling up with kids who are in mental health crisis. So I think that a lot of kids are experiencing increased depression, anxiety, and suicidality during the pandemic and unable to access the services that they need.
But unlike their peers, Dr. Gebford says LGBTQ youth have a harder time finding support at home. According to the survey, 80% said COVID-19 made their living situation more stressful because only 1/3 reported living in a home that is LGBTQ affirming.
So 2/3 of kids did not feel supported by their parents at home, versus about 50% of kids who feel supported in school.
With many students now returning to school, she says she's begun to see students reconnect with their peers and support systems. But she says the return of Pride in person promises an even more powerful hope is on the horizon.
It's a different way to celebrate identity. You know, so often we talk about accepting kids or loving kids, but we don't use the word celebration very often. And Pride is just one big, huge celebration. It's visual, it's community. It's a way to say, not only is it okay that you are LGBTQ, it's great.
Now, as those celebrations resume, Dr. Gebford says it's important not to look past the simple act of loving and supporting those kids for who they are, especially among family and friends. She says it has very tangible benefits. In fact, she said young people who report being supported have far better mental health outcomes and far lower rates of attempted suicide. Jana?
That's very true. Kent, Pride is a time when a lot of young people, and not just young people, a lot of people choose to come out to their friends and families. That space offers room to have that conversation. Because we didn't have big Pride celebrations, did Dr. Gebford see that trend change last year? And if so, how?
Well, she did see it change, Jan, and it was in a way that she didn't really expect. She said that a lot of LGBTQ youth have reported that they did come out to their parents, and maybe more so than in the past on online forums, but they haven't had that in-person connection until just recently, going back to school and some of those kind of gatherings. And she said that's led to a kind of second wave and some anxiety amongst kids. She said that's something that she's really going to be looking at as we get forward and get a bit back to normal.
Yeah, it's a little bit backwards because as she pointed out to me last year, it's usually kids to other peers and then at home. If this was home and then to kids, it's that coming out twice kind of deal. Important to talk about.
Yeah.
Thank you so much, Kent.